Hello, my name is Ann Coons. I'm a certified diabetes educator and I work for Citrus Valley Health Partners Center for Diabetes Education. And I'm here today to talk to you a little bit about diabetes. Our center is approved by the American Diabetes Association, and we're also an affiliate of the California Diabetes and Pregnancy Program, known as Sweet Success. November is National Diabetes Month. In fact, the official day is November 14th. This is a great time to remind all of you that it's time to be healthy. And I have some good recipes. In fact, I have a lovely pumpkin recipe. If you want to contact me, I'll be happy to share it with you. Diabetes is a huge problem for this country. It's about $218 billion per year of our taxpayer dollars. That's your money and my money. And do you know most of that money is spent in taking care of the complications of diabetes? Very little is spent in preventing the problems. And so that's what we're all about, is helping people prevent those problems from occurring. We want to prevent people from having an amputation, from having a heart attack or a stroke, from going blind, going on dialysis. And we want our women that are pregnant to have healthy children. There are about 25 million people in this country with diabetes, and a third of those don't even know it. You might have diabetes if you're thirsty. You might have diabetes if you're going to the bathroom frequently. You might have diabetes if you're always hungry. You might have diabetes if you don't have wounds that are healing. You might have diabetes if you're having problems in the sexual area. Or you may not have any symptoms at all. People can have type 2 diabetes for 10 years with no symptoms. If you're at high risk, and that might be over 40, a high-risk ethnic group, Asian American, African American, Mexican American, Pacific Islander, or if you are overweight, you're inactive, or you have relatives that have diabetes, you should go to a physician, a doctor, and be checked for diabetes. Education is very important for anybody with diabetes or those that have a potential for diabetes, although a lot of people are very afraid to come for education because they think they have to make sweeping changes. And really making little changes can make a big difference in your life. I often use the example of a big cruise liner having to change courses, but what makes that change is a small rudder. And so you might be able to make a little change but make a big difference in your health. For example, maybe instead of having a big old bag of regular potato chips, maybe you can have a smaller bag of baked chips. With the holidays coming up, this is also a very scary time for many people. You might think you can't have your turkey or your ham or your sweet potatoes or your tamales, but those things can still be included in a healthy diet. Usually it's just the portions that matter. If you are interested in checking your own blood sugar, we can provide you a free meter and we're happy to show you how to use that. Now, a normal blood sugar, if you have not eaten overnight, would be less than 100. If you're 100 through 125, that's a type of prediabetes. That would be called impaired fasting glucose. And if your blood sugar was 126 or above, that would be diabetes. We can also check 2 hours after a meal. A normal 2 hour after meal is under 140. If you're 140 through 199, that would be another type of prediabetes, impaired glucose tolerance. And if you're over 200, that's diabetes. I'd like to share some of our free services with you. We have a monthly free support groups. These are held by our marriage family therapist, Tammy Yamashita. We have support groups for those with adults, type 2, and adults with type 1 can also join it. We have a specific support group just for type 1s. We have an insulin pump support group that's led by Medtronics. We also have an adolescent support group, and this is really a fun support group. Tammy makes sure that the kids have sugar-free treats, and the goal is to really make sure these kids have their kids first and their diabetes second. Our classes for non-pregnant patients are 3 2-hour classes, and in those classes you will see a nurse, a dietitian, and a marriage family therapist. Upon completion of those classes, you will return about 4 to 6 weeks later for your first follow-up. And then every month for up to 18 months should you need extra time. Our patients that come through our program have access to us by email and also by phone.